people think that they can just kind of crunch numbers, make it until 65, retire, and then have that life for the rest of their life. And then they have this rude awakening at the end when they're like, oh crap, like this isn't a given, this isn't a right. As human beings, we have a tendency to gravitate towards groupthink and create these like religious like views in our minds of certain things, including these fad diets. And we've lost that art of medicine where we're not teaching our patients, we're not spending time with them. You go in and this patient's trying to heal and they're being fed French toast every morning and there's no protein. I just don't expect, I don't know how we expect patients to heal in some of these hospital settings.
Welcome, everybody. We've got Dr. Clayton Moss with us. He is finishing up his residency in physical medicine and rehabilitation down in Tampa, Florida, with plans to go into functional medicine. So welcome back, Clay. Good to see you again. So I guess for those that, first of all, most people have never heard of physical medicine and rehabilitation. I had some friends that did that. One guy I used to powerlift with did that years ago. He's still out there powerlifting in his 50s. Good for him. What drew you to PM&R, and then what is the plan afterwards and why?
Yeah, man. Well, thanks for having me on again. I appreciate it. It's good to see you. And yeah, so, I grew up in a little town on the panhandle of Florida called Gulf Breeze. And when I was growing up, this sports medicine complex called the Andrews Institute opened up over there. And it was kind of the mecca of sports medicine. So I would be walking home from school in like elementary, middle, and high school in this little small town and see, Shaquille O'Neal on the outside basketball courts warming up and, people, Tim Tebow and people going in and out. So at a young age, I kind of had this inclination to gravitate towards, sports medicine, performance medicine, human performance. And I kind of developed a little bit of OCD along the way and just, love just the thought of trying to optimize somebody as much as possible for whatever their goal is, whether it be, climbing a flight of stairs or going out and running a marathon or playing in the NBA championship, whatever it is. So I kind of had that seed early on and I didn't know how I was going to go about it. I knew I wanted to go into some sort of medicine, consider doing surgery, either plastics or orthopedics. And that was kind of my route for a long time until I got into my medical school rotations and just didn't love being in the OR for that, that long of time. And I really liked, face-to-face patient care and developing a relationship. And I didn't necessarily love most of my time being with a patient while they're unconscious. So I explored all my options. I found PM&R kind of through a mentor who was a plastic surgeon. And he said that he would have considered it if he had gone back. And, it's an interesting field because I didn't know anything about it either until I was third year of medical school. So what it is, it stands for Physical Medicine and Rehabilitation. The other term for it is PM&R or physiatry. There's like 3 or 4 different names, which is probably part of the reason why everybody doesn't know what it is. So, but what it is basically is trying to take a patient from their current form and make them more able to do either activities of daily living or achieve a certain goal. So whether that's in the inpatient setting with dealing with rehabilitation of traumatic brain injury, spinal cord injury, stroke patients, amputee patients, things like that, hip replacements, knee replacements, to the outpatient side, which is a little bit more like sports medicine, interventional pain. You can do some spinal procedures, a lot of ultrasound guided injections. I lean towards this route because I kind of took my early drive towards, human performance. And I thought that this was kind of on the cutting edge of being, that field that would have all the opportunities, especially with this new kind of regenerative medicine push and stem cells starting to become more available and PRP and peptides. And so I got a lot of needle exposure. So it's nice to have that interventional side of things too. Now, when I was right towards the end of my first year of med school, COVID happened. We all had to leave school. We had to go back home. Half of it was virtual for a while. We had to come back, forced to take 3 or 4 COVID shots to get back into the building. It left a little bit of a kind of a stain on what the thought I had of the traditional medical system was. And so I had been kind of yearning for this opportunity to get into something more. So something more patient focused, something root cause focused, not just putting Band-Aids on the problem. And so, all of this PM&R stuff is awesome. And it's kind of a means to an end for me to get to what's called functional medicine, which a lot of people have heard about, especially lately in the last couple of years. So yeah, I mean, that's kind of my story in a nutshell.
Yeah, I mean, you mentioned the Jimmy Andrews Clinic. That's obviously in orthopedics. No, he's done quite a bit of stuff out there, and I can certainly commiserate with your desire not to be in an OR. I can remember being scrubbed into a 20-hour hip revision, standing in the spacesuit for 20 hours without eating, without going to the bathroom, just not having fun.
Yeah.
Assisting, holding retractors for 8-10 hours while the attending surgeon did this ridiculously complicated procedure.
Yeah.
Fortunately, when I got into private practice, I don't. The longest surgery I'd ever do would be 2 hours. I mean, because you just get more efficient at it. And, you're not spending time doing all this stuff. But
Right.
I certainly can appreciate. And I think about if I were to go back into medicine, I think often about primary care because of what I do now is so much more of that. But I mean, the PM&R stuff is nice because it integrates both. Well, I mean, I can see where you would integrate functional medicine with some of the physical sides of it, because in my way of thinking, I think a healthy human is not only somebody who has, whatever good markers, but can also function. And, like I said, as I, get close to 60, jumping, sprinting, lifting, bouncing, all those things equal, in my view, health.
Yeah.
And I think it's, like I said, in as much as we talk about all these new peptides and shots and therapies, I'm like, man, you just get out there and be able to do stuff. That's really where, in my view, the magic happens. And if you're not doing that, if you're not aiming towards that, what's the point?
Yeah.
Anyway, all right. So functional medicine, there are, I think, governing bodies that will certify you, I guess. Is there a couple of them, or where do you go? Because I know, like, for instance, I don't know, there's a group called the American College of Lifestyle Medicine, which I don't know if it's called functional medicine, but they're all vegan. They're all a bunch of vegan wackos, right? Are there other organizations that certify functional medicine, or can you just put a name on your door and say, I'm a functional dude? What's the story on that?
Yeah, no, there are a few. And the last time we spoke, which was I think a year and a half ago, I was kind of on the search to try to find something because, we go through medical school, we go through residency, you have to take those standardized exams, you have those certain study guides that you can pay for, and there's kind of a structure about learning the material. And I didn't find that for a while. So I was just reaching out to people that I knew in the space, just saying, look, like I'm tired of, reading books that, are on the shelf at a Barnes and Noble. I feel like I need to get more into the weeds and more into the medical side of this and actually learn it from a stepwise progression. So I kind of went searching. I found American College of Lifestyle Medicine too. Ironically, they're working with the residency program that I'm in right now. And so a lot of the stuff that they preach, I agree. The vegan side, I don't agree with. So I'm kind of just trying to take bits and pieces from them. And then the one that I really fell in love with. So there's two big governing bodies, and they're both fantastic. One is the IFM, which is the Institute for Functional Medicine, and that's great. And then the other one, which I ended up going with, is A4M. It's American Academy of Anti-Aging Medicine. And they offer like a legitimate online fellowship where you can sit for the board exam and everything. So I'm currently about 3/4 of the way through that, doing a fellowship in longevity medicine. So it's
you're
been
doing a
nice.
fellowship concurrently while you're doing your residency, huh?
Right. Yeah. Yeah. On my own time, which is
That's
fine, which is good. I mean, like, the PM&R lifestyle isn't as hectic as a lot of those surgical
Yeah,
lifestyles.
I could have never done it, man. I was dead I didn't sleep for 5 years when I was a surgery resident, so there's no way I could have done another thing. But yeah, I get it.
Yeah.
So I mean, and good for you, man. I mean, it's just like, it's crazy the way we, and it's gotten better. But back in my day, and even before, and worse before me, training physician was just, particularly surgeons, was just an exercise in who dropped first. Go as long as you can without sleep. And the thought was, well, you're going to get called in the middle of the night to go in and fix somebody's hip or deal with some emergencies. You better get used to not having sleep. And that was a mantra.
Right.
And it just led to stupidity, mistakes, tired, pissed off physicians. And anyway, good for you for doing that. So
yeah, man,
what do you, go ahead. Sorry.
It's interesting. Like you compare now versus back then. And like, obviously work hours wise, now it's just cake compared to when you probably went through and trained. And there's still certain programs where, they want you to kind of stretch the truth a little bit about your hours. And thankfully I'm not at one of those, but there also are some added, stressors about nowadays because, you get into like, the internet goes further along. You have more study materials. You have better study materials. Things are more efficient. You have way more information. Like our medical knowledge, like increases at some insane rate every year. The Now with AI and everything, you're able to kind of work with AI to learn things quicker. And so it's funny because the physical toll is way less for us now, but there's like a mental aspect now that puts a lot more stress, because just to be competitive now, you have to take in so much more information to put your leg up over that person next to you.
Yeah, yeah, I can see that. I mean, and that obviously is not going in. The AI component, I think, and I'm not alone in this, I think that a lot of the physician tasks, if not some of the physicians themselves, will be replaced with AI. I think that will happen, just
Yeah,
because. And a lot of people are like, hey, I got some weird symptom. They'll look it up on Chat GPT or Grok or something like that and figure it out themselves. And half the
yeah,
time they do a decent job with it. If it's, I mean, obviously there's critical situations where that's not appropriate, but I mean, I can see that as
yeah,
a role. Now, let me ask you, because I think the last time we talked, I think you were maybe doing carnivore or something like that. What is your, obviously you're not a big fan of vegan diet. What are your how do you, and I got to tell you, when people say anti-aging, I'm like, I don't know about
yeah.
anti-aging. I think you can improve aging. I
Right.
don't think you can live forever. I mean, I know
Agreed.
there's people out there that are like, oh, I'm going to live to 120 or 150 because I take all these supplements. And I'm like, BS, dude. Until somebody shows it to me.
Yeah.
However, there are some remarkable specimens out there that are quite old. I mean, see some of these Hollywood actors that look, in their 60s and they look like they're 30. Now,
Yeah.
some of it's plastic surgery and filters, and they've got every resource known to man that can do that. But I do think there is um, a tendency for older people to age better, and
Yeah.
maybe that'll result in longer life. I don't know. Maybe just die at 80 like everybody else, but you look better. I don't know. We'll see
Yeah.
what happens with that. So, yeah, I mean, I'm always, it always, whatever, particularly when people promise that, and then that
Yeah.
makes me skeptical. So I'm like, do I get a money back guarantee if I don't live to 100? When am I going to collect? And, for me, I'd be
Yeah.
42 years from now. I mean, the guy's long going to be gone by then. My money's spent and gone, and, given to
Yeah.
the grandkids. So,
I mean, I agree with you. And I think the real emphasis that we need to be putting it on is health span instead of lifespan, right? Like this whole anti-aging movement. I think the good that can come out of it is, let's just deal with the things that we can deal with now to set us up for success. Peter Attia talks about this centenarian decathlon. And I really do like that mindset, because let's just say, in your final decade of life, you want to be able to, you know, lift a suitcase over your head, to put in the bin in an airplane, to be able to carry your grandchild, to be able to walk up 2 flights of stairs if you're to go travel Europe, to go on a train. People think that they can just kind of crunch numbers, make it until 65, retire, and then have that life for the rest of their life. And then they have this rude awakening at the end when they're like, oh crap, like this isn't a given, this isn't a right. You actually have to work for this kind of thing. So I'm a big fan of preventative medicine in that sense, and dealing with those things now. So like, let's go ahead and get your biomarkers now. Let's make sure that you're setting yourself up for success. Let's look at your muscle mass. Let's look at your VO2 max and how you're able to convert oxygen and how you're able to metabolize, and then we'll kind of, you know, look at algorithms here and there to figure out, okay, this is actually where you need to be now so that you can have that life that you really want to live in that last decade.
yeah, I mean, it's interesting when I do quite a bit of traveling on plane by now, and it seems to me, and maybe I'm imagining, but it seems like now every time I get on or off a plane, particularly when I get off a plane, there seems like there's like 15 wheelchair people, like lined up to get people off on wheelchairs. And it's
Yeah.
just like, is everybody getting so decrepit they can't even walk through an airport? I mean, it's kind of crazy to see that. It used to be
Right.
you'd see like one or two. Now, I mean, it's like there's like a line of like 10, 12, 15 people waiting to push people around on wheelchairs. Let
Right.
me ask you about the PM&R stuff, or maybe in the functional medicine. What assessment tools do you have? Because I kind of tongue in cheek say, man, it'd be great if you could line everybody up on the 1 yard, on the starting line and have them run 100 meters, and you could sort out
Right.
who's sick and who's not by how fast they can run. Because I think that is a legitimate tool. I mean, you think about what
Right.
it takes to be able to run a fast 100 meters. It takes health. You can't do that
Yeah.
if you're unhealthy, to include orthopedic health. And people say, well,
Right.
it's unfair because I got a bad knee. Well, you're not healthy. You got a bad knee. You are not healthy. You're a
Right.
lame animal. You're going to get eaten by a bear if we were in the wild. So, I mean, yeah, I mean, it may be an unfair comparison, but it's a real comparison. So what tools do you have? I know there's like dynamometers and there's other tests and stuff for hand grip and stuff like that. But what do you guys like to use?
Yeah, I mean, hand grip's a good one too. That's actually one that not many people use, and you can actually look at studies, and it's a good general sense of overall strength. So that's a good one. The traditional things that would be used would just be, I mean, physical exam is just going to be your best one, and that's kind of an art we've lost of in modern medicine. Is that we're looking a lot at labs, we're looking a lot at medications, and we don't actually put our hands on patients. And I have my MD, and I didn't go to DO school. And the one thing that really sucks about that is that all of my friends that are DOs and not MDs spent a significant amount of time actually, crossing that barrier and putting their hands on patients and getting to actually feel what's going on. Whereas, we kind of went through the motions, and we do physical exams, but we really don't get that deep into it. So learning a great physical exam goes so far, and if you can find a doctor that's good at that, that works wonders. The other ones are, you can look at DEXA scan, obviously, just judging body composition. How much muscle mass do you have at your age? Do you need more for your age? What your body fat composition is, because we know that body fat can be inflammatory. It also can lead to weakness if you're overweight. It's all these complications, like you see, the people on the plane that are in wheelchairs. Those that don't have spinal cord or brain injuries. A lot of those are just from deconditioning, from having uh, super high caloric diet, and just kind of over time just not using your body. And if you don't use it, you're going to lose it. So there's a couple other things too. VO2 max testing is one of my favorite, because I think that gives you a solid baseline of where you're at now. And I like to visually see where I'm at, not just have somebody tell me like, oh yeah, no, you need to do more cardio at your, 1 year checkup at your primary care doctor. I want to see, this is where you're at. This is suboptimal for your age if you want to get to point B when you're 65, right?
Yeah, I mean, do you guys do VO2 max testing, metabolic cart? Breathing into the mask on a treadmill, basically. Is that the typical way it's assessed, or do you guys have different tools to do that?
Yeah, it's different for everybody, and it depends on where you are. I see that more in the private practice setting, especially more cash based settings for that, because I feel like you have a different patient population coming in. You have kind of your weekend warriors more so that want to do VO2 max testing. Now, I think we should do it on anybody that can tolerate the test, obviously. But that's just what I see. So like usually we'll have patients come in, like on the inpatient side, it'll be more post TBI, post spinal cord injury, post stroke, some things like that. And there's a whole separate list of rules to try to figure out where a patient is at that point and then get them to where they need to be. So it just kind of depends on the setting.
Yeah, I guess somebody's quadriplegic or paraplegic, I should say, and then he maybe an arm bike or something like that.
Right.
Where you can get them to crank on there. What so as far as let's talk about body composition and muscle mass. I'm a huge proponent of lean. I think lean mass is important, and
Yep.
likewise, I think consuming protein to get there is important, as well as resistance training. What are some, or do we have any good metrics to say, hey, this is how much lean mass you should have? Are those numbers out there, or like body fat percentage? I mean, some people, trying to say what's lean enough, what's obviously too fat, and then does it make any sense to get any leaner? I mean, I saw something on women's perception of what a good body fat is for men is like 12%. That's what women think is attractive on men. But is that also correlated to health and longevity and health span? Or do we all need to be 6%? I don't know. What are your thoughts on that? Or do we have any data on that? Hey, folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly.
I'm 100% sure we do have the data, and I can't recollect it from memory. But yeah, you're 100% right. Like the key is taking somebody from where they're at currently and getting them closer to where they need to be. So let's just say where you quote unquote need to be, or let's just say you're at 35% body fat. Like let's try to get you as close to 20% as we can, and then if we get there, let's try to go a little bit lower. 6%. Obviously, I don't think that is even healthy at that point. I looked up something the other day, and it was higher than I thought. I think the average NFL wide receiver is like 12.2% body fat, which I thought it would be like 6%. But yeah, just trying to get closer to that goal. So like body fat's the big one that everybody, is concerned about. And especially with this whole, Ozempic GLP-1 movement, that's kind of the ball that we're missing, is sure, like we'll try to drop your body fat, but we're getting rid of muscle mass at the same time. And we're not spending that time with patients because, like anything, GLP-1s are a tool. They're definitely useful in some scenarios, but we have to be cognizant of spending that time with patients to educate them on you have to be doing, weight training. You have to preserve muscle mass because you can lose all the body fat you want, but if you lose muscle with it, that's really hard to gain back, especially when you're later in life. And the mortality rates of falling and getting a hip fracture are just horrendous. So we want to preserve as much as possible around those bones, around those joints, so that we can be safe whenever we get to that end of life time. And what I like to focus on, we always talk about metabolic health, and there's kind of this general rule of thumb that if you meet three of the following, you are considered metabolically unhealthy. So if I'm recollecting this right, I think it's for men, if you have an abdominal obesity, so waist circumference of over 40 inches, or women, I think it's over 35 inches. Um, if you have elevated triglycerides over 150, and then if you have reduced HDL, which is like good cholesterol, they say, men less than 40, women less than 50. If you have elevated blood pressure above 130 over 85, and then elevated fasting glucose over 100. So if you check the box on 3 out of 5 of those, you are considered having metabolic syndrome. And so those are the things that we really want to tease out too.
Yeah, I mean, back to the Ozempic stuff. I mean, I certainly would rather see people lose weight without taking medication whenever possible. And
Right.
I think for most people, it is doable. Sometimes it takes a long time. Sometimes it takes a lot of effort.
Right.
But when you do put these people on drugs, I think it would be criminal not to make sure they're lifting weights and doing strength training, eating adequate protein, because it's just, I mean, from what I've seen, the people that often will lose a lot of lean mass and
Yeah.
and bone mineral density too. I mean, it's and then so you're looking at, and you're absolutely right. It is so hard to put on muscle as an older person. Not that it can't be done, but it's like, when you factor in, joint pain and aches and pains and schedules and just all this stuff, it's like you
Right.
just don't have the resource a lot of times to put it on. I mean, I think what I do is a little bit exceptional. It's not unachievable for many people, I would say, but it's just, I really make it a priority for myself.
Yeah.
And it's not that everybody can do that or wants to do that.
Yeah, man.
So let me ask you, with your thoughts on nutrition in general.
Yeah.
It's interesting. Obviously, carnivore diet, fad diet, or if you want to call it that, I think it's a useful tool like anything else. There's now the sugar diet, which people are using. It's supposedly this is based on upregulating something called FGF 21, fibroblastic growth factor 21, which is elevated in high carb situations, but it's also elevated in high fat situations, elevated particularly in low protein situations. And so it's kind of like, and I think low protein is the biggest driver, particularly methionine. And so when you limit protein, it tells your body you're starving. Basically, your body's getting the signal that you are literally starving right now. Mobilize all your resources, and so you lose fat. But again, long-term muscle loss, and you look at like any fruitarian. For the vast majority of fruitarians are extremely thin.
Yeah,
and it's because they eat very little protein typically, because there's very little protein in fruit. There's some, but it's a tiny amount. And so we see that. So thoughts on any of that stuff?
Yeah, I have a lot actually. I really like how you pointed out that all of this is just a tool, right? Like, I think as human beings, we have a tendency to gravitate towards groupthink and create these like religious like views in our minds of certain things, including these fad diets. But I think that like one of the things that I like so much about your message is I've never really heard you say that everyone should go on a carnivore diet. Like, you lay it out pretty consistently that a carnivore diet is a tool that can be used in certain people given their situations. And for many people, it is beneficial for certain things like autoimmune disease, lowering inflammation, kind of getting back down to that baseline. And that's what I used it for. So, 3 or 4 years ago, I went on strict carnivore diet. I actually added in berries, so I guess it wasn't as strict. But did that for like 3 or 4 months straight. My face got slimmer. Like, I didn't have strep every single month. Like, all these things just ended up clearing up and got better. And, this is around the time of COVID and me figuring out, some of the ugly things when the, veil was lifted a little bit from the modern medical system. And so it got me thinking like, what are we not getting? Right. And so at this point, like I even have it, I just marinate it and everything. I'm literally sitting it. I'm about to cook it after I get
Nice.
back. I
Ribeye.
figured
Bone in ribeye. I like it.
exactly. But it is a tool. It's a great tool. It's the ultimate elimination diet. So, you know what? For a lot of people, it's not sustainable, right? Like it's hard. It's really hard to do. And to do it strictly and do it every day and not give up and those type of things. And like you're allowed to have cheat meals. Everybody should. Like don't live your life like a robot. You have to actually live. But for me, it was the ultimate elimination diet. Like I got rid of all wheat, all dairy, all carbs, all soy, everything, and was able to start from ground zero with grass-fed beef and some blueberries, and then kind of add things back. And I figured out, what I was a little bit sensitive to and what I wasn't, what I was able to tolerate. And so, now I'm at this point where I am very protein heavy. I'm not full carnivore anymore. Like I'll add in, some vegetables every now and then, and a lot of fruit. Not many carbs. Maybe I'll do quinoa and some stuff like that every now and then. But my body tends to crash after I go carb heavy. So I try to go as high protein as possible, and that just makes me feel as good as possible. And doing that carnivore diet a long time ago was my kind of route to getting to that place.
Yeah, it's interesting because a lot of people are in that situation where they use carnivore to solve the health issue, and then they transition away, and then some of them get like, oh, well, it's a wrong thing or something. I'm like, well, look, it's helping a lot of people.
Yeah,
put autoimmune disease in remission to fix their eating habits, and so it's a very useful tool.
Yeah,
and for some people it becomes a lifestyle, and you are right. I've never said everybody should do this. In fact, I've often got on my way to say not everybody needs to do this, but I do think it is a very effective tool, and like I said, there are studies that are starting to come out on this to show that it is efficacious. If anything, it should show people that meat is not deleterious to people as it's been portrayed, or at least whole unprocessed meat in particular.
Yeah.
So you got about another, so you're, I guess, right about a year left to your residency. Where do you see yourself in a year? Are you going to go, are you going to be sticking around Tampa, or are you going to head out somewhere? Where are you going to go?
I don't know. We've been playing with thoughts here and there. I have a little over a year, so we love it down here. Like my fiance and I love it down here in Tampa. But neither of us are from here. I'm from the Panhandle. She's from California. Her family lives in Nashville now. So everything's up in the air for us. It just depends on where the opportunity is. Like I obviously want to go into some sort of functional medicine practice, because that's just what I enjoy doing. Like I can't see myself in a hospital every single day of the week. I just don't see myself being happy there. So, just putting feelers out here and there, trying to figure out, where the best step is. Do I want to open up my own thing? Do I want to join a practice that I agree with? But yeah, it's just kind of putting feelers out.
Well, let me ask you, when I was doing my medical training, and I had a kind of a weird scenario. I started back in the 80s and then left to play professional sports and came back in, about 10 years later. But at that time, social media was not really, it was kind of discouraged. I mean, there was a few people talking about this as, 20 years ago.
Mm-hmm.
And now it seems like many physicians have a social media identity. In fact, it might even be almost a requirement in some regards. Is that something that y'all get training on in medical school or residency, or what are your thoughts on that? Is it necessary now?
I have some new thoughts. So no, we don't get any training on that in med school. And over the last 3 weeks, I've been trying to figure out, how to safely go about everything. Like back in February, I just decided, I'm going to start putting out educational content on Instagram and on TikTok. And, I'll put out a video every now and then, like maybe 1 or 2 a week, just kind of going over this is why vitamin D is so good. These are, where a lot of people's levels that they feel best at. And this is different types of magnesium, kind of simple stuff here and there. And then diet and lifestyle things too. Just to, like I said before, just put feelers out, see where it goes. And 3 weeks ago, it just, I posted one just about my thoughts about certain supplements, and it just blew up. Like I think it's at 6 million views now.
Probably TikTok, I'm guessing.
TikTok did go a little viral. Like I think it has 1 million, but Instagram has like 5 or 6 million now. So
Okay,
it's,
interesting,
and
cool.
then I went from, 2,000 followers to like, I don't know what it is now, like 180 or something. And so, it told me pretty quickly that people are yearning for this stuff. Like people want to learn. And I think that's a problem with modern medicine, is that we get a lot of inpatient exposure to patients that are at their absolute worst. Their momentum is down. They don't have the motivation anymore. And some of those patients actually, there are some patients that don't show the urge to get better. And I think we're stained by that experience in medical school and just the overall stigma around it, that when we get out into the real world, we kind of have this little brain fog of, oh, like, patients aren't going to listen to what we say. And but it really comes back on us, because if you go to your typical primary care appointment, they're not going to spend more than 10-15 minutes with each patient. And that's just not, the word doctor comes from a Latin root that means teacher, and we've lost that art of medicine where we're not teaching our patients, we're not spending time with them. And so, I guess my job going forward, or what I want to do, is just put that information out into the world, because I'm in my early stages of learning too. I'm finishing up my training. Like I want to share the information that I'm learning with people at the same time, so that they at least know and can take control of their own health.
Yeah, fair enough. Yeah, I mean, it is. I mean, you are supposed to be a teacher as a doctor, and the one thing, and I made this sort of, I don't know if I want to call this, just observation, that when it comes to what goes into healing, there's a whole bunch of things. I mean, sleep is a healing process, exercise, activity, what you eat, obviously,
Right.
how you mitigate stress, our circadian biology, all of it can impact disease in a very positive or negative way, depending on how it's done.
Right.
And, my training as an orthopedic surgeon involved almost none of that. I mean, there was
Yeah.
nothing. I mean, I might get some general appreciation for some of that stuff, but no like expertise in that. I mean,
Right.
that's something I had to sort of seek out myself and develop my own expertise. But I don't know
Right.
if you feel the same thing. I mean, we seem like, unless you're like a sleep medicine specialist, you don't really ask your patients about sleep much. Maybe it
Yeah.
might maybe come up every once in a while, but it seems like it should be part of a general functional assessment. Like, what's the sleep like? What's the nutrition like? What's the
Yeah.
activity level like? All those things. And if they're not dialed in, then we have to make sure they get dialed in. It's not just, you should do some more exercise. You have to
Yeah.
facilitate them doing it, because
Yeah.
what I find, and this is one of the things I found with Revero. I mean, we literally nag patients. we're like the nagging mom. Hey man, why aren't you doing this?
Right.
But some people need that. I mean, to get
Yeah.
it done. I mean, it's just like, it's enough to talk about it, but not.
Yeah.
Most people don't do it, as you know. They won't make changes unless you really facilitate it.
Yeah, everybody's got their own motivations. And I agree with you, more so when I was in medical school and during my intern year, I saw that, where we were just completely neglecting those things. And, we'd have patients in the hospital. We'd be waking up at 4 a.m. I think we talked about this before too. And you go in and this patient's trying to heal, and they're being fed French toast every morning, and there's no protein. And I just I don't know how we expect patients to heal in some of these hospital settings. But I will say the caveat to that is I am very blessed in that I have 2 program directors that I'm training under that are very in tune with metabolic health and functional medicine, and they're so open to it. And so our patients really have benefit from those guys, because, one of them in particular is he's running at the VA hospital, like an inpatient metabolic rehab program. And it's unbelievable the difference that some of these patients can get. Now, we can only take one patient at a time, and so we're not getting the volume that would be as beneficial as possible. But it's good to be in a learning setting where the physicians in the academic setting are very cognizant of that stuff, because I think that's pretty hard to come by.
Yeah, I mean, it's definitely improving to some degree. I think social media is forcing that in many ways, because you can see the patients are like, well, I mean, it's not hard to find a lot of patients about the healthcare system, and I think we could just some of it's warranted, some of it may not be, but a lot of it is.
Yeah,
and I think some physicians are actually taking note of that and adjusting accordingly. Others are just doubling down and saying, "Oh, you guys are just conspiracy theorists and following quacks and all this stuff." And I mean, and good, that's where they want to stay. That's where they can stay, and they'll go extinct like the rest of the dinosaurs, I think. But what do you do? So how do you, obviously, well, I mean, again, it sounds like you've got enough time for personal sleep, like general health within your
Yeah.
residency. Is that fair to say? What do you do? How do you, because I mean, for me, it was like, it was like eat when you can, sleep when you can. That was
Right.
our mantra. And it was like, you didn't get to do much of it either. And then I would exercise when I could.
Yeah.
But, what do you do daily, or what is your schedule like, or what things are you emphasizing?
Yeah, I mean, you're right. Like our residency program is probably not as brutal as a lot of other ones out there. Still can be at some times, especially when you're on call and you're sleep deprived, and those are the times that you really need to take care of yourself, because it's a momentum thing, right? If you stop the momentum, it's a lot harder to get back on track. For me, I mean, something I picked up years ago, like I try to start every day with a little bit of mindfulness, which has worked wonders for me. Like I noticed that I was better able to have conversations with people and remember people's names and look at them in the eye and feel comfortable in my own skin. So I take 5 to 10 minutes each morning and do a little bit of like, whether it's meditation or just kind of sitting in silence. Eating healthy is number one for me. So like if I'm eating whole foods, real foods, one ingredient food, and not eating out a ton and not eating fried foods, like my mentality is just night and day difference than what it was if I was doing the opposite. And I was doing the opposite in med school and in undergrad. I'm rarely ever sick. And then I always try to prioritize doing exercise. So like I love strength training. Like that's just kind of my escape. So I try to strength train 5 times a week, if not 6. Now I'm starting to add in a little bit more cardio, because I do understand that is important too, even though it's not as fun. So I do that. Sleep hygiene is huge. My fiance is very health conscious as well, so it really helps. But as far as sleep, we have blackout curtains in our bedroom, or in my bedroom and in hers. We have a sound machine, so we're not woken up by other things. We try to keep the temperature pretty low. We limit, blue light exposure towards the end of the day, try to cut off all the overhead fans, keep just lamps on so it's a little bit lower than eye level. So just little things here and there kind of stack up. And then you kind of find yourself in this place of, okay, I'm actually getting good sleep. I'm feeling well. I'm not having any depressive thoughts anymore. I'm able to be present in my conversations. So little things here and there.
All right, fair enough. Well, I'll tell you what, Clay, tell me, like, share your social media handles, website, whatever you have for people if they want to follow your journey, you learn more about PM&R, functional medicine, so on and so forth.
Yeah, man, both Instagram and TikTok. I probably do most on Instagram, but it's just Dr. Clay Moss, DrClayMoss. And getting a podcast up and running soon. I literally said this last time too, and I didn't start it, but in July, we're going to do our first episode. And so that'll be up and running at some point. So we'll get a little more educational with some different perspectives and things. So yeah, it's great. Functional medicine is a good route to go. If you find a good doctor, I think the key is that everything in moderation, and then using tools as you need them. So a lot of people will hone in and just completely disregard everything else. Like say, I'm only going to do supplements, no medications, or only medications, no supplements. And Peter Attia had a really good analogy, and it doesn't matter. Like, let's just say you wanted to build a table, right? You really only need like some wood and a hammer and some nails, right? But we can really hone in on trying to build that table as sturdy and as beautifully as possible. And there's a certain amount of tools that you need for that, and it's not that many. Or if you want to build a Formula One car, you're going to need a lot more tools, right? So it's kind of using different tools in the context of what patients want to do. So yes, medications are good in some instances when you're using them right and not just covering up symptoms. Supplements are good when you use them right. So I really love this field. I'm excited about where it's going, and I hope everybody can learn a little bit from it and hopefully find a doctor for them that's gonna help them change the trajectory of their life.
All right, so it's Dr. Dr. Clay Moss, ClayMoss. Clay, yes, thanks, man. Good luck finishing the residency and the functional medicine fellowship, and let's chat again when you get done with all that stuff, man. All right?
Yeah, man. All the best.
All right, take care.